Your heart full, and when you are there, a patient was fallen. What should you do? Your heart full, and when you are there, a patient was fallen. What should you do? First of all, it is important to check if the patient got injured from the fall. If there are any symptoms that requires a medical assessment, call a doctor or a medical team to deal with the problem. After that, in Korea, we make a paper about what happened to report to the Patient Safety Service. We also share the situation in handover so that we can alert a possible fall and prevent it next time. A patient's relatives keep complaining about your previous worker. What should you do? A patient's relatives keep complaining about your previous worker. What should you do? The most important thing to do in that situation is a sincere apology. Basically, they complain because they are not satisfied with our service. Therefore, I would apologize on behalf of my coworker and ask what could make you feel better. If they didn't come down despite the effort, then I would tell a senior staff or a supervisor about what's going on and get some advice so that the problem can be figured out properly. Do you know what news tool is? Do you know what news tool is? Yes, I've studied news tool when studying about CBT test. It stands for National Early Warning Score, which instructs if a patient's condition will be aggravated in the future with his or her vital sign. A healthcare assistant told you that one of carers was aggressive to the patient. What should you do? A healthcare assistant told you that one of carers was aggressive to the patient. What should you do? In that case, I would instantly intervene them. If the carer physically offended the patient already, then I'd call the police or security team as instructed in the manual. When you assess the patient, you found a new pressure sore. What should you do? When you assess the patient, you found a new pressure sore. What should you do? From what I've learned in Korea, we need to measure the size first with the longest width and height of the sore and check how deep and severe it is. After sorting out the grade of the sore, if it's worse than first grade, we contact WOC nurse to treat the sore. One of your patients has severe dementia and tries to go out saying, "I have to go to take my kids." What should you do? One of your patients has severe dementia and tries to go out saying, "I have to go to take my kids." What should you do? Well, I'm not sure if it's also possible in the UK. In Korea, we used to allow the patient's relatives stay with him all day. For dementia patients, it's also a good idea to make the ward feel familiar. His own stuff like a blanket or a clock can help. So I'd call his relative and tell the situation to ask them to come over with his stuffs and hopefully stay with him.